Ladies and gentlemen, I would like to discuss today with you a very important topic about prostatitis syndrome. Prostatitis syndrome is classified into four classes. Class 1, which is acute bacterial prostatitis. Class 2, chronic bacterial prostatitis. Class 3, chronic abacterial prostatitis. And class 4, symptomless bacterial prostatitis. Anyway, the most important of these four groups is the abacterial prostatitis, because bacterial prostatitis comprises 10% only of the chronic prostatitis group. As a matter of fact, the etiology is not certain. And whenever the etiology is not certain, so the treatment definitely is not sure or curative. Definitely is not sure or curative. But we found that the most important etiologic factors, number one is the compromised immune system. For example, we found that zinc is present in the prostatic secretion in the form of zinc protein, and it acts as a natural antibiotic. In chronic prostatitis group of people, and usually they are young men, and by the way, you have to differentiate between chronic prostatitis and benign prostate hyperplasia, which is in an older group of men. Anyway, we found that the zinc is depressed and minimal in the prostatic secretion of this group of people. We tried to increase the zinc orally or parenterally, but no use, because we give zinc as a metal, not as a metalloprotein, which is an antibiotic. The second factor concerning the chronic prostatitis group is the bacteria, the infection. As I have told you, it is 10% only. And this bacterial infection comes from probably the partner of the patient, probably comes from hematogenous group, but usually in 80% of cases it is E. coli. Other rare groups of bacteria, but it doesn't matter, it is usually E. coli. A third factor of chronic prostatitis is the colonic disorder. Colonic disorder, we found that there is an association between the colonic disorders and the prostatitis group of patients, probably because of the neighborhood of these two systems together. Another important thing is that the reflux of urine through the prostatic ducts. As you know, I mean the doctors, there are 12 ducts in the prostatic urethra, and whenever the bladder is empty and a sudden cough or increase of intra-abdominal pressure, usually the urine refluxes into these prostatic ducts into the prostate, inducing a state of chemical irritation to be followed or not followed by bacterial infection. So the message here is an empty bladder as much as you can. The management or the treatment of chronic prostatitis, the golden rule is prevention is better than cure. So we try to teach the patients. Number one is the empty bladder. Try as much as you can to have an empty bladder because of the fear of refluxing urine. The second thing is the sexual life. The golden rule as well is all or none. Whenever there is excitement, it should be followed by ejaculation, Because if there is excitement without ejaculation, the prostatic secretion is retained, which is a good medium for bacteria, and usually this is followed by bacterial infection. Also, the spouse or the partner, one has to be sure that there is no cervical secretions or, infected cervical secretions or infected vaginal secretions as well. Because probably the urethra is the only conduit in the body which has retrograde peristalsis. And after sexual intercourse, the vaginal secretions, when they are in the urethra, by retrograde peristalsis, the infected vaginal secretions go through the urethra to the prostatic urethra to the prostatic ducts, inducing prostatitis. Of course, the antibiotics, but not any antibiotics, but the antibiotics which can cross the prostatic barrier. The most important of these are the fluoroquinolones, like the or ciprofloxacins or pfloxacins or levorotatory floxacins, like anyway, well, is one of the antibiotics which can cross the prostatic barrier. The trimethazole as well and trimethoprim are kind of which can cross the prostatic barrier, but they have no effect more than 10 days. So as you see, the most important things is to be careful, and mind you that chronic prostatitis is a recurrent disease. So one has to be careful to prevent the recurrence of this disease.